So, how big of a deal is the coronavirus really? Are we all overreacting? Are we underreacting? How should we think about this? What should we do? I'm not qualified to speak to the medical side of this at all, but thankfully there are a lot of people in my church who are. And so I'm going to sit down with some of them as I'm able to and interview them to get their thoughts on the coronavirus, what it's doing right now, how we should look at it, and how we should respond to it. Brett and Eileen are members of our church family. They're married to each other, but you're going to see in this interview that they're staying in separate parts of their home. They're using different devices because Brett has already been exposed to the coronavirus. And so he's trying to keep that as far away from his family as possible, taking a lot of great precautions to make sure that doesn't happen. I really appreciate these two because they are on the front lines of dealing with people who really have COVID-19. And I appreciate them also because as Christians, they want us to respond to this in a way that shows Christ's love to other people. So I'm going to ask them about the coronavirus, how we should think about it, whether it's close to the flu or something different, what it's going to do over the next couple of months, what life will look like for us because of it, and how we as Christians should respond in the middle of a pandemic. Well, I've got Brett and Eileen with me. Brett and Eileen are both members of the church that I go to, and they're married to each other, but because of the coronavirus going around, they are in separate parts of their house right now to make sure that they're not transmitting any virus to each other. Both are doctors and serve in hospitals in different ways. And so, Brett and Eileen, I wonder if you two could just share with me a little bit about your experience and training and how that helps you to understand the current pandemic that we're facing right now. Maybe we could start with Brett and then Eileen.
I'm an emergency medicine physician. I work at St. Luke's in Chesterfield. Obviously, as someone who's trained in medicine, it gives me some perspective on this, but no one in several generations has been through something exactly like this. The closest comparison is the 1918 flu over a century ago. While I'm used to dealing with contagious diseases that we have to, like antibacterial resistant bacteria and antibiotic resistant bacteria and even regular flu, and even used to dealing with some disasters such as weather events, this is a completely different magnitude. There's not much preparing for this. For something of this magnitude.
Yeah. And how about you, Eileen? What's your specialty and what do you do as a doctor and how is that interfacing with the coronavirus pandemic right now?
So I'm an internal medicine doctor. Specifically, I'm what we call a hospitalist, meaning that I see adult patients who are sick enough to be in the hospital only. I don't have a clinic. I work at Washington University at WashU at the School of Medicine there. So my office is downtown at Barnes Jewish Hospital at Big Barnes. And my division, the Division of Hospital Medicine, is actually one of the primary divisions designated to take care of COVID-19 patients. So essentially any COVID-19 patient in the hospital who is not needing intensive care is being overseen by members of my division right now. We're fortunate in this country that the last several pandemics that made the news, Ebola and SARS and MERS, really did not have a significant impact here. But the downside of that is that this is kind of catching us unawares. And I think, we're used to thinking when it comes to disaster response, we're used to thinking, like you said, about weather-related responses, natural disasters, but this is a totally different ball of wax. We've mobilized as a physician community very quickly to do our best to deal with this. And fortunately, here in the Midwest, we haven't been hit quite yet. And so we've had some more time to think about it, but there are emails flying back and forth every day. And every hospital in the region, I think, has been doing its best to try and prepare for what we expect is going to be a bad situation.
Yeah. And I want to get into that a little bit. First, I just want to thank you and say how much I appreciate you being willing to do a video like this, because I think that the two of you are going to be trusted voices, especially for our church. You go to our church, you're heavily involved there, involved in teaching there and other ministry. And so we know you and we trust you. And I think it'd be helpful for people to understand just your perspective on what we're dealing with. You know, we've got a whole spectrum here from people who think that the coronavirus, the novel coronavirus, is no big deal and it's nothing to worry about, probably mortality rates on par with the flu. So why are we treating it any differently than we would the flu, and putting our country into economic lockdown? And then you've got other people that are extremely concerned about it, almost to the point where there's probably some paranoia. There's some hoarding of supplies and personal protective equipment. There's just a lot of panic and anxiety and fear out there. And I, as a pastor, get messages from people who are on both ends of this spectrum. I would love to hear from the two of you how serious you think this pandemic is, and whether you think that it is different than the normal flu and other respiratory viral diseases that we might get. How would this be different than that, and why would we treat it any differently?
Yeah, so this is much worse than the flu on several ways. Its mortality rate is still somewhat a matter of speculation. If you just take the total number of cases worldwide and the total number of deaths worldwide, you get a number around 4.6%. But of course, we don't know the total number of cases, and the deaths actually lag the cases by about a week or more, so that number's low too. So that's not a good measure. There was a study in China looking at 44,500 cases, so a really good sized study. 81% had mild, like basically a cold with a fever, basically like the last time you had the flu. About 15% had severe pneumonia, low oxygen, trouble breathing. 5% were critical with multi-organ failure, and half of those died. So 2.3% was the death rate in that study. And that's on par with other statistical modeling we have. That's the closest cousin to this virus that infects humans was MERS, and that had a 44% fatality rate. So that 2.3% is a very reasonable number. That would make it about 30 times deadlier than the flu if you catch it. And the infectivity of it is about twice that of the flu. It's about twice as contagious. So the average person with the flu will pass it on to 1.2 people more. The average person with this passes it on to 2.5 other people. So it's twice as contagious and 30 times more deadly. And that actually, in a weird way, if the disease is too deadly, it's actually not as dangerous because it kills the host before they can spread it. And they also show symptoms right away. The reason MERS and SARS and Ebola were better contained is because it was easy to figure out who had it and contain them. And this one, you don't usually show symptoms for about 4 to 5 days, and you're probably contagious before that. So there's no containing it. The WHO is estimating 40% of the world will have it. In industrialized countries, maybe as high as 80% like ours. If that's true, the worldwide death toll would be around 70 to 140 million, which would make it the deadliest event in human history by about 3 times. In the US, the death toll this year would be 3 to 6 million.
Those are shocking numbers, obviously. And
the biggest event of the century.
Yeah, right. The biggest thing since not just 9/11, but going back to World War II and the flu of 1918 that went around. If those numbers prove true, which there is so much speculation, it seems, involved right now, this would obviously be devastating. And of course, there's a lot of concern about the specific ages of people involved in this, or people with underlying health conditions. I know that it seems like the mortality rates are much higher for people over a certain age. Can you speak to that at all and share kind of whether this is something that younger people don't need to worry about as much? Is this something that older people especially need to worry about? Do they need to just lock themselves in their houses and not go out even to get groceries, get somebody else to deliver groceries to them?
Young people do die from this. Thankfully, mercifully, children usually are pretty safe. In the early data out of China, there was not a single pediatric death. Now, there were several who got very sick, but none that died. Now, that is, with having this many cases now, inevitably some children have died, but most of them are either asymptomatic or have a mild cold. However, young adults, they have a higher mortality rate, and with each increasing decade of life, it goes up. If you're in your 70s, data out of Italy and China show it's about 8 to 12%, it's about 10% mortality rate. If you're in your 80s, it's 15 to 20%. So it starts getting really, really high as you get older. And then also if you have heart disease, diabetes, lung disease, immune suppression, kidney disease, cancer, or hypertension, all of those have been associated with higher death rates as well.
So what do you think about all of the young people? Maybe Eileen, I'll ask this question to you. What do you think about all the young people who are, it seems like, avoiding some of the restrictions and going out and hanging out with each other? Is that okay for them because they're at a fairly low risk?
So there's two parts to going out, right? One is the risk to you and one is the risk to somebody else that you know. So the risk of getting it versus the risk of dying, right? So the risk of getting it is still high no matter who you are. And we do know now from studies that there are a large number of people out there who are not manifesting symptoms at all, who have it and are capable of spreading it to other people, but who feel totally fine and otherwise show no signs that they have it. So as a young person going out there, even if you feel totally fine doing whatever you're doing, you still could be contracting COVID-19 and then going home to spread it to, your parents or your grandparents or, your siblings. So from that perspective, it is still incredibly a terrible idea. We are now seeing, like Brett was saying, young people, young, healthy people, 20s, 30s, who are physically active, don't have any other known, diseases, who are dropping dead from COVID-19 very quickly in some cases, because this virus has the ability not only to affect the lungs and cause a respiratory illness, but it also has the ability to cause heart failure and very rapid onset heart failure. So young people are certainly not immune to this either. And so for their own protection, in addition to the protection of the people around them, they really need to also be respecting all of the recommendations when it comes to social distancing and staying at home.
I have personally seen young people without a lot of other conditions, with no medical history, be put in the ICU for this.
And one of the things that we're hoping for, that some people are hoping for, is that we will see an end to this soon, because we want to get the economy working again. We want to get people out of their homes, and we're all hopeful that that's going to happen as quickly as possible. What are some realistic outlooks for that? There's a thought that maybe the warm, moist air of summer might help to bring the cases down. Of course, then there's the possibility of seasonality for this virus. And what would that look like for us? What's kind of our outlook for the future for the way this pandemic could go?
There's a panel of experts that they're polling once a week. And the last one was Monday, so it's getting a little outdated, but they were asked when they think hospitalizations week, and the most common answer was May, and over 2/3 of the answers were between May and August. August had still 10% of people thought August. It's likely to drag out. It's counterintuitive, but we don't want this to be over soon, because if it's over soon, that means we failed, because the goal, if you've heard the term flatten the curve, the idea is, instead of having millions of cases all at once, if we socially distance and slow the spread, it's still going to go through the population because how effective it is, but it'll take longer to do it, which means not everyone gets sick at the same time. And hopefully we don't exceed our capacity. We have 160,000 ventilators in the country. The National Strategic Stockpile has another 16,000, so we can expand our capacity about 10%. If millions of people get sick, we need to expand our capacity by 2,000%. That's not realistic, especially if it happens in the next month. And so not only will we exceed our capacity, and the mortality instead of 2.3% maybe like 15%, but also all the doctors will get sick at the same time, the nurses and the healthcare workers, and there'll be no one to deliver the care. So we could see it spiral out of control if we don't flatten that curve, if we don't extend the infection out through the summer. As to the seasonality, we don't understand why some viruses are seasonal and others aren't. The common cold isn't seasonal, but the flu is. There's another strain of the coronavirus that's almost harmless, causes the common cold. It's not seasonal. If it is seasonal, that would also be a worst case scenario, because in order to be seasonal, it has to be both pandemic and endemic, meaning it has to be everywhere and there has to be a constant reserve in the population, like influenza. And if that happens, when it comes back in the fall, it'll come back kind of everywhere all at once. That's what happened in 1918. There was a mild, slightly worse than normal flu season in the spring. It went underground, and then in the November, that's when everyone died. When it came back in the second wave, there was a third wave the next spring. And so that would be absolutely disastrous if it became seasonal, because that means we're living with this for the foreseeable future.
So what should we all be doing at this point? Should we be staying inside? Should we be following the social distancing? Should we be making sure that we don't gather in more than groups of 10 at a time? What of this is actually effective, of these guidelines that have been handed down to us, or in some cases, actual orders, stay-at-home orders, shelter-in-place orders?
So yes to all the things, basically. So looking at how this disease is spread, it's spread, we think, primarily through droplet, which means so respiratory droplets. So basically your spit or any sort of liquids coming out. So when a person who gets sick coughs or sneezes, they spew microscopic droplets into the air that then sort of settle. And then those droplets which contain the virus, can then be spread to other people. And those droplets enter through your mucous membrane. So, your eyes, your nose, or your mouth would be the primary means of entry. So we basically, all of these measures that are recommended are to try and put a stopgap somewhere in that process, right? So when we say cover your mouth when you cough, cough into your elbow and then don't touch your elbow like my son is inclined to do, but cough into your elbow. So try to keep the droplets in, or wear a mask if you're sick to try and again keep those droplets from kind of spewing everywhere is step one. If the droplets get out, then we're talking about droplets on surfaces. So trying not to go out into the community where you're touching the same doorknobs and elevator buttons and everything else that everyone else is touching, right? Light switches and things, and staying outside of 6 feet, that 6-foot radius of a person, so that when they do cough or sneeze, if they don't take the proper precautions to protect you, at least, hopefully you're not being spewed with droplets. And then in addition to that, when inevitably, unfortunately, you do get some droplets on your hands because you touched, the thing, not delivering it to an entry point in your body. Your skin is perfectly good at keeping viruses out, but if you give that virus a lift to a doorway to your body by rubbing your eyes or scratching your nose or not washing your hands before you eat and then transferring those droplets into your mouth, then that's how the virus gets around. It can't move on its own. It relies on people to move it. And so every precaution that we've talked about now and in the news is designed to break that chain.
I say most of the spread in China was people didn't know who they were exposed to, and it's probably because people are contagious before they show symptoms. So it's not just coughing and sneezing; it's just talking, and those droplets from these little humidity in the air that comes out of your lung that contains the virus, they travel 6 feet, so 6 feet distance, and then they settle on surfaces. So disinfecting surfaces, washing your hands when you touch them, and not touching your face. The average person touches their face every 2.5 minutes. We do it subconsciously. We see masks that people wear. The masks are great if you are already sick to catch the droplets. They don't really protect the person wearing it because, one, it doesn't cover their eyes, and two, if you've ever worn a mask, you know that you're constantly adjusting it, so you're actually touching your face more. So if you're in direct contact with someone who's sick and you're wearing it just for that encounter, there's probably some shield from the spraying droplets. But it's probably counterproductive for a healthy person at this point, as far as we know, to wear the mask out and about, because you're just going to be more likely to spread it from a surface, your hand to your face, because you're touching your face more.
That's really good to know, because I know a lot of people are thinking about the masks, wearing them when they go out. When I've gone to get food or something, I'll see, a bunch of people wearing masks out there, and you never know if they're doing that because they are sick and they're trying to protect people. Maybe they've already been tested and don't have the coronavirus, but have something else. It's hard to know, but you're saying there's no reason for us to be wearing those masks when we go out and about to try to protect ourselves.
If you're sick or think you may have it, you're protecting other people by wearing it. So like the reason I'm self-quarantined isn't because I have symptoms, it's because I'm constantly exposed to people with symptoms. And so I will probably eventually get it. And when I do get it, I won't know until several days after I've already been contagious. So when I go upstairs to get food out of my quarantine, I wear a mask. And if I have to go out in the community to go grocery shopping or something, I'm one of those people you see wearing a mask, but I'm not doing it to protect me. I'm doing it to protect everyone I come in contact with.
That's a good point.
One other reason that we don't want to have everybody out there in the community scrambling to put a mask on right now, whether they're symptomatic or not, is because simply, we are experiencing a massive shortage of masks among healthcare providers. So people who are actually, in high risk situations, right up there in the face of somebody confirmed to have COVID who's coughing, they're the ones that really, really need to be having masks. And right now, hospitals and clinics all over this country are struggling to have enough masks. Usually when we put a mask on, we discard it immediately after an encounter with a patient, regardless of what kind of condition it's in. And we are no longer doing that. Now we're forced to ration what we have, and wear the same mask for multiple patient encounters. Unless it gets wet or dirty, we're re-wearing it, which is not ideal. But even big institutions are putting out the call for businesses to donate any sort of protective equipment. So we do not want the public to go out there and buy like 200 masks, which may or may not have any benefit to them, but certainly could be better used in the hands of people who are putting themselves in much higher risk situations right now.
Yeah.
So what do you think we can do to be helping other people at this time? I think one of the hardest things is for those of us, especially, who are Christians and want to be helpful to people and share with others and comfort others. And for me, I'm a pastor. And so I want to be with other people when they're struggling through things. The result of the stay-at-home orders is that we cannot do that. And in fact, we can't really get close to people. So do you have any advice on how we as individuals, as followers of Jesus, as a church, can actually be ministering to other people during the course of the next few weeks, several weeks, couple of months, whatever it is that we are sort of stuck apart from each other?
First and foremost, like I was thinking about this issue, and I think education is the first thing that comes to mind. A lot of what we're trying to do now to make sure that we minimize the number of people who are going to suffer and unfortunately die from this. So getting the word out and trying to make sure that you and everyone you love are actually following instructions and complying and not sneaking and cheating would be the number one thing. It's not entirely what you're asking, but for me, this is the most important thing, because survival is more important than comfort. In the other vein, in terms of all of the new problems that the need to social distance and stay at home are creating, so there's going to be a lot of social isolation, a lot of loneliness, as Brett can attest to. He's very lonely down in the basement, and we miss him, and we're in the same building. I know of a lot of physicians that have actually either sent their children away to live somewhere else, or have moved out of their homes to try and protect their families from this. So a lot of and a lot of people live alone, and now they can't go anywhere. So social isolation, that's going to lead to depression, worsened depression, anxiety. If you have conflicts with the people that you're sheltering with, that's going to be a problem, because now you can't go anywhere. I think a lot of this is going to be psychological. So staying in touch. Now we fortunately have the technology, and most people have access to it, to be able to, at least face to face like this, if not in person, calling, texting, chatting, video chatting with people on a regular basis every day, not just here and there, but making this actually like a daily routine to check in with the people that you love and care about, and maybe finding new people to love and care about, to check in with who don't have other people.
I'm especially heartbroken about the issue of children, because until you brought this up earlier this week to me, I hadn't even considered the fact that so many kids who are not in happy homes and have parents who do not treat them well are now stuck with those parents, or spouses, partners who are with someone, a significant other, who does not treat them well, and they already felt trapped in that relationship, and now they are literally trapped in that home with that person. These are situations that I think we need to be praying about, especially praying for God's protection over these people. But also, if there's any way that we are able to identify some of these situations or know about them, to reach out to these people and help them through this time, because it's just devastating to think of the people that are right now trapped in homes that before they were able to find escape from, and now they are not.
So I think we just need to be really vigilant about checking in and making sure that we're on the lookout for situations like that, and looking for warning signs that maybe people need help.
Sometimes people ask me, what people can do to help with the medical situation. And there's not a lot that can be done for that. But one of the things, if you want to help out there, is that because people are scared to go to the hospital, we're actually having a huge shortage in the blood supply. So if you donated blood, or if you never have, that would be a place where you actually could help out. We just yesterday had a blood drive at our hospital. DePere has one next Friday. But even if, you can go to the Red Cross anytime and donate blood. The one thing, if you decide to do that, is you should call ahead, because they're trying to space out the appointments so there aren't lines, so that you're not coming in contact with unnecessary groups. But that's an area medically you could help out if you're interested in that. The people I'm worried about most are the people who were already at risk, shut-ins and at-risk populations, like homeless or refugees, because not only are they at risk directly from the disease and all the things we're going through, but the aid avenues that were previously available to them are being cut off. As an example, about a month ago, the Peace Corps evacuated all of their volunteers around the world. And so that's just gone. And even within our community, at-risk groups, like if you need a ride to the hospital and the person that you would normally get the ride from is socially distancing and you don't have that ride. So those are the kind, or the person's just scared to go to the hospital, even to drive you. So those sort of people are at higher risk. And so I think we need to proactively think about who in our orbit may need an extra, may need someone to reach out to them. And even if we don't think they do, reach out to them anyways and just ask how they're doing and if they have some needs. And then you can be creative about how you fulfill those needs. The social distancing rules don't mean you can't even interact with someone in person. You just need to keep 6 feet distance. There are still some needs that need to be fulfilled in person, and you just have to be cognizant of these recommendations when you do it. But we still need to, more now than ever, we need to make a really concerted effort to try.
Yeah, that's really helpful. So obviously this is a very concerning time and situation, and it's caused a lot of anxiety for people, for many people anyway. And now I'm kind of curious, do you have any good news for us? Is there any reason to be optimistic about this? Kind of what's the realistic but optimistic outlook for this thing?
I think as we discussed earlier this week, when I talked to people about this, I feel like that Debbie Downer character from SNL, that like everything I say is negative, because a lot of the news is negative. In terms of the actual situation itself, one of the heartening things is that children are relatively unaffected. If they get it, they tend to be fairly mild. There's a lot of bad news if you're an adult, but that is mercifully true, that kids tend not to be much at risk, like younger kids tend not to be much at risk for this. Beyond that, I would say my cause for hope isn't based on the situation itself. I think you would agree with this. It's based on my faith in God. My favorite passage in Scripture is Isaiah 12. It's only 6 verses long, but verse 2, which is my favorite verse in the passage, says, "Behold, God is my salvation. I will trust and not be afraid. For the Lord Jehovah is my strength and my song. He also has become my salvation." I like that because it uses the name Jehovah there, or YHWH or Yahweh, depending on your translation, which is derived from the I am that I am, the idea that God his existence isn't dependent on anything else's existence. He transcends that. And so that from which all reality flows is my strength. And so I don't have to be afraid, but not just my strength, he's my song. He's the strength by which I live, but also the reason for which I live. And the next verse then says, "Therefore with joy shall you draw water out of the wells of salvation." So, my hope is not dependent on the circumstances, and I can be joyful because of that. And I'm hopeful in this circumstance because when we're faced with our mortality, we tend to turn to God. 9/11 was on a Tuesday, and 5 days later, churches set attendance records all across the country. And so that hope that I have, I am hopeful that other people will find that as well because of this.
Yeah, that's really good. And Isaiah wasn't exactly writing under fantastic circumstances either. Things were not going too well for Israel at that point. And so that's incredibly hopeful for us as well.
In terms of, things like silver linings for this, because it is a very scary situation, and we don't want to, downplay how scary this situation is and how serious it is, because we need people to act appropriately and accordingly. But at the same time, when you ask this question, what good is coming out of this? I think in addition to what Brett said, this is going to pass. This isn't forever. And as scary as this is, because this is uncharted territory for us as Americans, like, we know that there's going to be a time when this isn't happening. It might be further away than we want it to be, and we're going to have to be really, really patient, and we might end up taking a greater hit to our economy than anyone's comfortable with, but it will pass.
Obviously, a lot of people are getting information from different sources today. Some of those are more reliable than others. Where should people look for reliable information as this situation is constantly changing?
Well, if you're looking for the numbers, which are constantly updating, the CDC hopefully will have updated numbers soon. But for now, there's something called the COVID Tracking Project, which you can just Google. and it'll give you updated and state-by-state information with links to the state's information. For Missouri, the Department of Public Health has a website. I'm sorry, I don't know the URL off the top of my head, but if you Google Missouri Coronavirus GIS Hub, HUB, you'll find it, and it has a dashboard with a lot of that information. And then the WHO has good worldwide information, but actually Johns Hopkins has better worldwide tracking information. As far as the actual recommendations, what you can do, the CDC is probably your best bet. World Health Organization is good as well, but the CDC is more boiled down to what Americans need to know and geared toward the resources Americans have. So they're still the best resource.
Hey, I want to thank both of you for taking all of this time to explain all of this to us. I learned a lot of things today, and I especially want to thank both of you for being on the front lines of this thing. Here are two people, two parents, you've got two awesome kids and a baby at home, and yet you are still making sacrifices and working things out so that you can both be in there and exposing yourself in a way to a risk so that the rest of us can be in our homes and safe. And so I hope that people watching this will take that into account. You've probably heard or seen the pictures of doctors holding up signs saying, we're staying at work, so please stay home for us. And that really is, I think, an important message for all of us to take away from this. Here are two people right here who are going back into the thick of it on a regular basis and taking personal risks and even family risks in order to do this. And so the least we can do is be praying for you and honoring some guidelines that will help to keep more people safe, because you are trying to keep more people safe in your profession. So I want to thank both of you. I'm sure everyone who watches this is thanking you as well and appreciates everything you're doing. And we'll be praying for you, praying that God watches over you and keeps you healthy and safe throughout all of this. I am so thankful to have people like Brett and Eileen in our church. I've been leaning on people like that. There are many other medical professionals in our church as well that I've been able to consult with and get their advice on things. Along with the senior leadership team and our elders, I'm trying to lead our church through a big shift right now. And I want to make sure that I'm getting good information and good advice as I'm doing that. And I've realized along the way that all of that great information and advice that I have been getting from people who are trained to handle medical situations and people who are on the front lines really needs to be shared with others as well. So I'm really glad that they were willing to share that with all of you. I've got more interviews coming up with more medical professionals who will give us insight into this. And it's changing every single day. So in a few days, I'll have another video with someone else, and we'll probably have some new updated information at that point that I hope will be helpful for you. If you are someone who needs help, there's a button on our website that says, I need help. And you can click on that and let us know what your needs are. And if you're someone that can offer help, there is a button on our website right next to it that says, I can help. You can go there to let us know that you're willing to help. We are trying to match people with needs to people who can meet those needs right now. And of course, there are many needs that we're just going to take care of as a church as we are able. So let us know if there's a way that we can help you or a way that you can offer help, and we'll make sure to get you in touch with the right people, whether you have needs or can meet those needs. I want to ask you to be praying for all of our healthcare professionals like Brett and Eileen and many others, many who go to our church and many who don't go to our church. Some of them know Jesus, some of them don't. But all of them are going to be at risk in the coming months, if they haven't been already, from the coronavirus. One of the devastating effects of this that we're seeing in other parts of the world and even other parts of the country now is that so many doctors are getting coronavirus. That's keeping them from being able to help people who they would normally be helping because it's so easy to contract. It's so contagious. So I ask you to pray for all of our healthcare professionals, for Brett, for Eileen, for everyone else, that God would protect them and keep them safe, and that He would allow them to help a lot of people during this time.